Just be happy with who you are. Just be happy with who you are. Just be happy with who you are.
Hi, and now we're into part 2 on schizophrenia syndrome, and we're going to focus mostly on looking at the theoretical perspective and look at some of the treatment factors. So we're going to begin with theoretical perspective. The psychodynamic perspective, in the more traditional psychodynamic model, schizophrenia represents a regression to the psychological state corresponding to early infancy, in which the proddings of the id produce bizarre and socially deviant behavior and gives rise to hallucinations and delusions. Harry Stack Sullivan placed more emphasis on the mother-child relationship, anxious and hostile interactions. The psychodynamic perspective have not been able to empirically. Now, when you see the term empirically, it means bias-free and genuine research, if you will. Bias-free, and most notably, reliable and valid. Sorry, I lost the word there for a moment. So the psychodynamic perspective have not been able to empirically demonstrate this early childhood experience or the mother-child relationship to be a source of cause for schizophrenia in adults. In fact, that's one of the myths that some of you might have been choosing, is how mothers or fathers or collectively parents cause mental illness in their children. So if we move into the learning perspective, learning theorists propose that some form of schizophrenic behavior may result from the lack of social reinforcement, which leads to gradual detachment from the social environment and increased attention to the inner world of fantasy. You can add to this modeling and selective reinforcement of bizarre behavior may explain some schizophrenic behaviors in the hospital setting. That is to say, if you're in a hospital setting among other people, of which some are schizophrenic in their diagnosis, you might learn, by getting some reinforcement, some of those people, you may learn some of those schizophrenic behaviors. As one witnesses bizarre behavior, they can act as a model source or a meaning, or gain some sort of positive reinforcement. Now, the biological perspective, research has demonstrated strong linkages between biological factors and schizophrenia. Evidence for genetic factors comes from studies of family patterns of schizophrenia, twin studies, and adoption studies, which starts to make the connection a lot more strong. The mode of genetic transmission remains unknown. That is, how this genetic transfer or transmission of schizophrenia occurs is unknown. Most researchers believe that neurotransmitter dopamine plays a role in schizophrenia, especially in the more flagrant features of the disorder. Overactivity of dopamine centers, the site where dopamine molecules attach and lock, people with schizophrenia tend to have more dopamine receptors and are more sensitive to dopamine. Neuroleptic drugs, these drugs block dopamine receptors, thus reducing the effect of dopamine and the impulse giving rise to schizophrenic behavior. Now, viral factors have also been involved, but despite defining proof of viral involvement is lacking. Some work is being done to look at not just viruses, but also to look at other attacks from on the immune system as a reason to explain or a cause for schizophrenia. Now, evidence of brain dysfunction and structural changes in schizophrenia is accumulating. The use of technology like PET scans and EEGs and CTs and MRIs have really helped identify any abnormalities within brains of people with schizophrenia. Enlarged ventricles are one of the findings. This also suggests a loss of brain cells. The hippocampus and the amygdala, these are two structures of the limbic system, the system that regulates emotions and higher functions. As is often the case with psychological disorders, there are few clear answers or explanations for them, but researchers are certain about causal pathways. There's often an interdisciplinary explanation or a shared of perspective to get at some of the root causes and ways to help people with schizophrenia. Now, you might remember the interactionalist model, the diathys stress model. Diathys stress model posits that schizophrenia results from an interaction of genetic predisposition, that's the diathys, and the environmental stressors like family conflict, child abuse, emotional deprivation, loss of supportive figures, and early brain trauma as being the vulnerabilities. Now, there are family theories. The family factors such as communication deviance and expressed emotions. They may act as a source of stress that increase the risk of development or reoccurrence of schizophrenia among people with genetic predispositions. In the 1950s, the double-blind communication theory, whatever the child does is wrong, were considered the disturbing communication within families. In particular, the studies looking at communication deviance and expressed emotions. So there is an element that communication can have a role. Now, we've mentioned communication deviance. Now, this involves a parent's vague, unclear, or disruptive and fragmented communication with their children, and where the parent does not really focus on what the children are saying. This may become a risk factor for schizophrenia in genetically vulnerable individuals. Now, there's that underlying genetically vulnerable. Expressed emotions is another measure for disturbed family communication. Now, here the family is not supportive of the person with schizophrenia. Instead, they are hostile, critical, and unsupportive. This family condition is very difficult to improve, or if they have improved, it's very difficult to maintain that improvement. There appears to be some cultural variables that expressed emotion is affected by. So we've looked at somewhat the theoretical perspective, and you probably can see there's not a lot of definitive answers, and there aren't. But biological seems to have a strong potential, but alongside other things. So when we look at treatment, well, clearly at this point there's no cure for schizophrenia. Treatments for schizophrenia are typically multidimensional, and that makes sense. It involves a mix of biological, psychological, and rehabilitation approaches, and we're going to look at these. The biological approaches, typically, antipsychotic medication is not a cure, but it does tend to stem the more flagrant aspects of the disorder to reduce the need for hospitalization and the risk of recurrent episodes. Today, the most common neuroleptics include phenothiazine, chlorpromazine, thoradazine, which if you're looking at brand names, you're looking at Mellaril, trifluoropurazine, or stelazine, which is the product name, and fluofenazine or Moditin, all as well as sort of haloperidol, which no one knows the product name is Haldol. They appear to block dopamine receptors in the brain, thus reducing the elevated dopamine effects, hallucinations, and delusions. There are risks to using neuroleptic medications too long. One of the most primary risks was known as tardive dyskinesia. Now, it's a major risk to extend the use of neuroleptics. Tardive dyskinesia is an involuntary movements of body parts, eye blinking, facial tics, lip smacking. These would be involuntary, and they are repetitive and can resemble Tourette's syndrome. Medication needs to be carefully managed, and with people suffering from schizophrenia, this can be very difficult to do. The psychoanalytic approaches have not been very effective in treating schizophrenia. So there's not a lot we can offer in psychoanalytic approach. Learning-based approach, they look at treatments that include token economy systems, where By virtue of what you do behaviorally, you can earn reinforcements, tokens, that can be cashed in for larger reinforcement schedules. So it enables them to sort of learn behaviors through learning, and it seems to have some effect. There's been some computer-based token economy systems that have worked really well. Cognitive behavioral interventions with social skills training have achieved some success in increasing adaptive behavior among people with schizophrenia. The token economies systems have shown some early promise. They use tokens and earning of tokens based on the demonstrated pro-social behaviors and have been successful in the development of better social functioning and reduced psychotic behavior. The cognitive behavior therapy with social skills training could include teaching individuals to manage stress better and show how they can manage their symptoms. Now, this has been where we've seen some hope demonstrated with these techniques. Now, the psychosocial rehabilitation, these approaches help people with schizophrenia adapt more successfully to the occupational and social roles in the community. Self-help groups in more structured psychosocial rehab centers, learning self-reliance skills, cooking, shopping, and bus and taxi use helps integrate people back into the community more. Family intervention programs, family intervention programs help families cope with the burden of care, communicate more clearly, and learn more helpful ways to relate to the patient. The introduction of structured family intervention programs show a reduction in relapse, which is important. Some of the early intervention programs, there are two main forms of early intervention programs. The first is to initiate treatment as early as possible once the person has developed schizophrenia. The second is to intervene before the onset of schizophrenia. These will be prevention programs. And they're helpful, but these, again, treatment is likely to take an integrated approach, and when we do, there tends to be a greater ability to manage symptoms and to reintegrate into society as normal as possible. And again, I will post in week 12 in Journal 5 2 videos that will have 2 people speak about their experience, and I hope you find that useful and helpful. All right, there we go. Part 2 is done. We have one more piece of content, one more week, and then we are done. We're getting close, everybody. Good luck.